what is this technique which is helping millions of childless couples conceive and experience the joy of parenthood? Have you ever thought what is test tube baby or IVF procedure? I am Dr. Roshi Satija, and in this video we will see in a nutshell what is IVF procedure and how do we do it. In an IVF procedure, we prepare eggs in a lady and then take them out of her body and fuse them with the sperm. Once an embryo is formed, it is transferred back to the woman's womb. Which are the couples that require IVF treatment? The women who have blocked fallopian tubes, the male who has decreased sperm count, the women with immunological causes and polycystic ovarian syndrome, the couples who have all their reports normal, like their fallopian tubes are normal, sperm count is normal, the woman has no problem of endometriosis and she is ovulating regularly, but they are unable to conceive. These couples are termed as unexplained infertility. IVF is also done in such couples. The IVF procedure is divided into 5 stages. First stage is developing follicles in the ovary. As we are aware that follicles are developed in the ovary of a woman, and in IVF we require more than one egg. So, in the first stage, we give FSH injection to the woman to develop eggs. In the second stage, we remove the eggs out of the body and then we fuse them with the sperms. And in the last stage, which is embryo transfer, we transfer these embryos into the uterus of the woman. Weeks after embryo transfer, we check the pregnancy in order to know whether the woman has conceived or not. If the pregnancy test is negative, then we may have to repeat the embryo transfer process if the embryos are frozen. Now let us know how IVF procedure occurs in the lab. After recovering the eggs from the ovary of the woman and preparing the husband's semen sample with the help of an advanced technology, that is intracytoplasmic sperm injection or ICSI, the egg and sperm are fertilized. 18 hours later, fertilization check is done where we get to know how many embryos are formed. Next day, we see 2 cells in the embryo, which is called a 2-cell stage. Then there are 4-cell stage, and on the 3rd day, 8-cell stage embryo develops. Normally on day 3 or day 5, embryo transfer procedure is done. Embryo transfer does not require any anesthesia or sedation. It is done with full urinary bladder and ultrasound guidance. It does not require any admission. Approximately half an hour after embryo transfer, the woman can be discharged from the hospital. 15 days after embryo transfer, pregnancy test is done. If the test is negative, then the embryo transfer procedure is done again if the embryos are frozen. If the test is positive, then the IVF medicines are continued for some time. Now this was a gist about IVF. If you have any queries pertaining to IVF, please let us know. We'll be very happy to help you.